Have you ever looked into the toilet bowl after using the bathroom and noticed foam? Not just a few quick bubbles that pop within seconds, but a thick, persistent layer of white froth that stubbornly stays behind. Even after several minutes, most people see it once, shrug it off, and assume it was just the force of the stream or something they ate. But when it keeps happening week after week, morning after morning, it becomes something your body is quietly but persistently trying to communicate. Today, we are going to talk about what persistent foamy urine actually means, what it can signal about your kidneys and your overall health, what other symptoms to watch for, what tests to ask your doctor about, and exactly how to start protecting your kidney health right now, through practical, everyday changes. This is a longer, in-depth video, and I want you to stay with me all the way through because by the end, everything you need to know about this topic will be clearly laid out for you. Let us start with the basics. Why does urine foam in the first place? Your kidneys are two fist-sized, bean-shaped organs, sitting on either side of your spine. Every single day, they filter around 200 liters of blood. All the blood in your body, cycling through repeatedly. Their job is to pull out waste products, toxins, and excess substances, which get expelled as urine, while keeping the things your body needs, including proteins, glucose, and electrolytes, safely in the bloodstream. This filtration happens through roughly 1 million microscopic units called glomeruli. Think of each glomerulus as an extremely precise strainer, fine enough to let small waste molecules pass through, while blocking large molecules like protein. Under normal conditions, very little protein should appear in urine. A healthy kidney excretes less than 150 milligrams of total protein per day, and less than 30 milligrams of albumin. When glomeruli become damaged, protein begins to leak through into the urine. And here is where the foam comes in. Albumin, the primary protein in your blood, has a soap-like surface active property. When it is present in elevated amounts in urine, it reduces surface tension and causes the liquid to foam, much like detergent does in water. The more protein present, the more foam produced, and crucially, the longer that foam persists before disappearing. Normal water bubbles created by a fast urine stream typically disappear within a minute or less. Foam caused by protein in urine tends to be denser, more layered, and significantly more persistent. Medical professionals generally consider foam that lasts longer than 5 minutes after voiding to be a signal worth investigating for proteinuria. Now, it is worth noting that not all foamy urine points to a kidney problem. Dehydration can concentrate urine enough to cause a foamy appearance. High-speed urination hitting the toilet water creates physical bubbles. Eating an unusually high protein meal can temporarily increase protein in urine. Intense exercise can also cause a short-term rise in urinary protein. These transient causes typically resolve within a day or two. The concern begins when the foam is consistent, dense, layered, slow to dissolve, and recurring over weeks. At that point, your kidneys deserve a closer look. Let us go through the main medical conditions that cause persistent foamy urine. Diabetic nephropathy is the leading cause of chronic kidney disease worldwide. When blood sugar remains elevated over many years, the delicate microvessels inside the glomeruli gradually sustain damage. Early on, only tiny amounts of albumin leak into urine, a stage called microalbuminuria. At this point, foam may not yet be visible to the naked eye, but a lab test will catch it. If unmanaged, the leakage increases progressively, and eventually, full-blown proteinuria and declining kidney function follow. People with diabetes should have their urine, albumin, and kidney function tested every single year. If foam is already appearing, do not wait for the next scheduled checkup. See your doctor now. Hypertensive kidney disease is the second major cause. Chronically high blood pressure forces excess pressure through the fine blood vessels in the glomeruli. Over time, those vessels thicken, harden, and narrow. Blood flow to the kidneys drops. Without adequate circulation, kidney tissue is deprived of oxygen and nutrients. Glomerular filtration weakens, and protein begins escaping into urine. Importantly, damaged kidneys lose their ability to regulate blood pressure effectively, creating a damaging cycle where high pressure injures the kidneys, and injured kidneys make blood pressure harder to control. Breaking that cycle early is critical. Glomerulonephritis is inflammation of the glomeruli themselves. It can follow a bacterial or viral infection, or arise from autoimmune conditions. Inflamed glomerular membranes become leaky, allowing both protein and red blood cells to pass through into urine. The result is both foam and reddish or brown-colored urine appearing together. Acute glomerulonephritis can come on suddenly with swelling around the eyes, facial puffiness, elevated blood pressure, and decreased urine output alongside foamy and discolored urine. Nephrotic syndrome is a condition where glomerular damage causes massive protein loss, over 3.5 grams of protein per day leaving through the urine. As blood albumin plummets, the osmotic pressure of the blood drops, and fluid shifts out of blood vessels into surrounding tissues, causing significant whole body swelling, morning puffiness around the eyes, swollen ankles and feet that worsen throughout the day. Extreme fatigue and very heavy persistent foam in urine are the hallmarks of this condition. It requires prompt medical evaluation and treatment. Lupus nephritis affects the kidneys as part of systemic lupus erythematosus, an autoimmune disease. Research suggests that within 10 years of a lupus diagnosis, approximately 2/3 of patients develop some degree of kidney involvement. Lupus nephritis can cause both proteinuria and blood in the urine, and can lead to rapid decline in kidney function if untreated. Lupus itself most commonly affects younger women and presents with a wide range of symptoms, including skin rash, joint pain, fatigue, and oral ulcers. Urinary tract infections can also cause urine to appear cloudy or slightly foamy, due to white blood cells and bacteria in the urine. However, this type of frothiness is typically accompanied by burning during urination, urgency, frequency, and sometimes foul-smelling or discolored urine. Proper antibiotic treatment resolves the infection, and the urine appearance normalizes. Now let us talk about the accompanying symptoms that should prompt you to act without delay. Persistent swelling, particularly around the eyes in the morning, and around the ankles and feet in the evening, suggests that protein is being lost from the bloodstream into urine, lowering blood albumin and allowing fluid to shift into surrounding tissue. If you press your thumb firmly into the swollen area, and the indentation remains for several seconds before slowly rising back, that pressing in pattern, called pitting edema, is a red flag. Many people attribute morning eye puffiness to too much salt the night before, or a poor night of sleep. But when it combines with foamy urine, take it seriously. Blood in the urine, producing a pinkish, red, or cola-colored appearance, alongside foam, can signal significant glomerular injury. This combination warrants same-week medical attention. Unexplained worsening of blood pressure in someone whose hypertension was previously stable may reflect declining kidney function, because the kidneys regulate blood pressure through hormonal and fluid balance mechanisms. Kidney damage disrupts that regulation. Unusual fatigue and shortness of breath may reflect kidney disease-related anemia. Healthy kidneys produce erythropoietin, a hormone that stimulates red blood cell production. Damaged kidneys produce less of it, red blood cell counts fall, and the result is tiredness, breathlessness, difficulty concentrating, and pallor. Even in the absence of iron deficiency or other common anemia causes, changes in urination patterns matter. Needing to urinate frequently at night, nocturia, can be an early sign that the kidneys are losing their ability to concentrate urine efficiently during sleep. Decreased total urine output can indicate worsening kidney function. Either change occurring alongside foamy urine should prompt evaluation. Loss of appetite, nausea, and a metallic taste in the mouth can develop in more advanced kidney disease, as waste products accumulate in the blood. These symptoms alongside foam are a clear signal that medical evaluation should not wait. When you visit your doctor with concerns about foamy urine, here is what to expect in terms of testing. A basic urine dipstick test checks for protein, among other markers, and is a standard part of any annual physical. If protein is detected, follow up testing with a urine albumin to creatinine ratio, a more precise measurement that accounts for urine concentration, provides a clearer picture of how much albumin is actually being lost. Blood tests for serum creatinine and the estimated glomerular filtration rate, eGFR are the primary measures of kidney function. Normal eGFR is above 90 ml per minute per 1.73 square meters. An eGFR between 60 and 89 suggests mild reduction. 30 to 59 indicates moderate reduction, and below 30 signals severely reduced kidney function. Blood urea nitrogen and serum albumin levels round out the kidney function picture. Kidney ultrasound allows visualization of the kidney's size, shape, and structure without radiation and helps identify stones, cysts, masses, or obstructions. In cases where the cause of significant proteinuria is unclear, or where a specific type of glomerular disease needs to be confirmed, before treatment decisions can be made, a kidney biopsy may be recommended. A small sample of kidney tissue is examined under a microscope to identify the specific pathological process at work. These tests are available through primary care, internal medicine, or nephrology clinics. If you have had persistent foamy urine for more than 2 weeks, do not wait for your next annual checkup. Schedule an appointment specifically to address this symptom. Now let us get into the practical side. What you can actively do to protect and support your kidney health. Reducing sodium is the most important dietary change. Experts recommend keeping sodium intake below 2,000 milligrams per day for people with kidney disease. That is about 5 grams of salt. For context, a single serving of canned soup can contain over 800 milligrams of sodium, and a fast food meal can push well past 2,000 in one sitting. Read nutrition labels. Cook at home when possible. Season with herbs, lemon juice, garlic, or vinegar instead of reaching for the salt shaker. When eating out, ask for sauces on the side and use them sparingly. Managing protein intake is nuanced. For people with established chronic kidney disease who are not on dialysis, clinical guidelines typically suggest limiting protein to 0.6 to 0.8 grams per kilogram of body weight per day. For a 150-pound individual, that translates to approximately 40 to 55 grams of protein daily, less than the general population recommendation. However, this restriction should always be combined with adequate calorie intake to prevent muscle loss, and it should be tailored to your specific kidney function. Stage in consultation with your doctor or a registered dietitian. For healthy individuals without kidney disease, there is no need to restrict protein. Choose quality proteins. Egg whites, fish, and chicken breast provide complete amino acid profiles with lower phosphorus burden than red meat. Plant proteins from tofu and legumes are also generally gentler on the kidneys. Limit or avoid processed meats, which are high in sodium and phosphorus additives. Blood sugar management is essential for anyone with diabetes. Keeping HbA1c, the 3-month average blood sugar measure, at or below 7%, is a widely recommended target for protecting kidney function in diabetic patients. Though individual targets should be set with your physician, choose whole grains over refined ones. Limit sugary beverages entirely and incorporate regular physical activity. Do not adjust or stop diabetes medications without medical supervision. Blood pressure control is equally vital. A target below 130/80 millimeters of mercury is generally recommended for people with kidney disease. Certain blood pressure medications, specifically ACE inhibitors and ARB drugs, provide kidney protection beyond just lowering blood pressure. By reducing pressure within the glomeruli and decreasing protein leakage into urine. If you are on these medications, take them consistently every day as prescribed. Never stop blood pressure medications abruptly. Regular moderate exercise, 30 minutes of brisk walking, cycling, or swimming on most days of the week supports blood pressure control, blood sugar regulation, and healthy weight maintenance. Research confirms that exercise training is an effective strategy for blood pressure control. In people with chronic kidney disease, start slowly if you are not currently active, and check with your doctor about appropriate intensity for your specific situation. Be cautious with over-the-counter pain medications. Nonsteroidal anti-inflammatory drugs, commonly known as NSAIDs, including ibuprofen and naproxen, reduce blood flow to the kidneys and can trigger acute kidney injury, especially in people who already have reduced kidney function. Acetaminophen, taken at recommended doses, is a safer alternative for pain relief when you have kidney concerns. Always disclose kidney disease to any healthcare provider before starting new medications. Avoid smoking entirely. Smoking accelerates kidney disease progression by damaging blood vessels throughout the body, including those supplying the kidneys. If you currently smoke and have proteinuria or reduced kidney function, quitting is one of the most impactful steps you can take right now. Staying well hydrated, approximately 6 to 8 glasses of water daily helps. The kidneys flush waste effectively under normal circumstances. However, if your kidney function is significantly impaired and urine output is reduced, excessive fluid intake can worsen fluid retention and swelling. Your doctor will advise you on the right fluid intake for your specific situation. For your 7-day starting plan, here is a straightforward approach. On day 1, observe your urine carefully and note foam persistence, color, and any accompanying symptoms. Measure your blood pressure morning and evening and write it down. On day 2, log everything you eat and honestly assess your sodium intake. On day 3, begin actively reducing sodium. Halve the amount of sauce or salt you add to meals, and swap one processed food item for a whole food alternative. On day 4, increase your water intake and reduce coffee if you currently drink more than 2 cups daily. On day 5, begin a 10-minute walk after one meal and see how it feels. On day 6, check for swelling around your eyes upon waking and around your ankles in the evening and record what you notice. On day 7, call your doctor's office and schedule a urine and blood kidney function checkup. That appointment is the most important action of the entire week. Before we close, a few crucial reminders. Everything discussed today is general health education and does not replace a medical evaluation by your doctor. Foamy urine has multiple possible causes, ranging from completely harmless to medically significant, and only proper testing can determine which applies to you. If you have existing health conditions, take medications, or have symptoms beyond just foam in your urine, please see a healthcare provider rather than managing this on your own. Kidney disease, when caught early, is far more manageable than when discovered late. The foam in your toilet bowl may be the earliest warning sign your kidneys ever give you. Pay attention to it. If this video was helpful, please like it and subscribe to our channel. Share it with someone you care about, a parent, a sibling, a friend with diabetes or high blood pressure, because this is exactly the kind of information that can make a real difference when it reaches the right person at the right time. See you in the next video.